In the 2023 article, Plasma Donors Are Being Exploited in America, linked below, quote, "The United States is one of 5 countries where it's legal to sell your plasma, and roughly 20 million people here do it every year. Donating plasma is a low-paid labor that has become essential to an exploitative global medical industry," end quote. In a previous video, I focused on an episode of The Simpsons where Bart donates plasma on the wrong side of the tracks in exchange for $12, or $26 to $28 adjusting for inflation.
$12? Hey, I can bleed.
Hey, you've got to be 18 to sell your blood. Let's see some ID.
Here you go, Dollface.
Okay, Homer, just relax.
Ow!
While there has been a wider awareness of payday loan companies targeting poor areas, the quiet increase of plasma donation centers in low socioeconomic areas, especially leading up to 2020, may not be the net good it presents itself to be. To be clear, this is focusing specifically on the human element of donating plasma and some medical testing and how the health of the poor is being exploited for cash. This video will also not get into the specifics of the process to extract the plasma from a medical standpoint. Rather, this is to look at the structure and system of plasma donation centers. Feel free to like, subscribe, ring the bell, and with Mothra the Bunny of Data Science and the help from one of my close friends who used to work as a phlebotomist, let's look at these donation centers and why the Simpsons depiction from the 1990s is not too far off. It's probably good to start with what plasma is exactly and why it's important in the medical field. Stanford Medicine explains that, quote, "Plasma is the largest part of your blood. It makes up more than half of its overall content. And separated from the rest of the blood, plasma is a light yellow liquid. Plasma carries water, salts, and enzymes. The main role of plasma is to take nutrients, hormones, and proteins to the parts of the body that need it. Cells also put their waste products into the plasma. The plasma helps remove the waste from the body. Blood plasma also carries all parts of the blood through your circulatory system," end quote.
Left and right ventricle, left and right atrium, yeah they do it. They circulate, they pump blood through your lungs for oxygen, and then your arteries take it through to your body, and your veins bring the old blood back to be renewed.
Plasma is an important component of our health. To add more from the University of Rochester Medical Center, quote, "Along with water, salt, and enzymes, plasma also contains important components. These include antibodies, clotting factors, and the proteins albumin and fibrinogen. When you donate blood, healthcare providers can separate these vital parts from your plasma. These parts can then be concentrated into various products. These products are then used as treatments that can help save the lives of people suffering from burns, shock, trauma, and other medical emergencies. The proteins and antibodies in plasma are also used for therapies for rare chronic conditions. These include autoimmune disorders and hemophilia. People with these conditions can live long and productive lives because of the treatments. In fact, some health organizations call plasma the gift of life," end quote.
You put the wrong emphasis on the wrong syllable.
As far as what treatments it's used for, similar to mentioned above, plasma can be given to burn patients or those with severe liver disease. According to donatingplasma.org, it can also be used to treat IDP, idiopathic thrombocytopenia purpura, hereditary angioedema, or CIDP, chronic inflammatory demyelinating polyneuropathy. Plasma is certainly an important component in improving the quality of life for many patients. This isn't to argue whether or not people should be donating plasma. The issue is the source of the plasma for these treatments, and whether or not those who donate are receiving appropriate compensation that offsets the cost to their health and time. From various sources linked below, the general list of consistent requirements to be able to donate are the following. Be over the age of 18, have a minimum weight of 110 pounds or 50 kilograms, pass a medical exam which varies from location to location, submit a medical history, test non-reactive for transmissible viruses such as hepatitis and HIV, be generally fit and healthy, and that definition also kind of depends on the location.
Everything is based on what people say. Paid donations entail a certain risk. They encourage donors to lie about their health.
It's computer asking you. No. Who to say though, if I was lying when I said my tattoos was over 2 years old?
There are items that will disqualify a candidate from being able to donate, such as getting a tattoo in the previous 3 months, been pregnant in the last 6 weeks or trying to get pregnant, or if they take certain blood thinner medications. In my case, I'm unable to donate blood or plasma because I lived in certain parts of Europe for a significant period of time before 2000, and I always get terrible hematomas when I have blood drawn.
By the way, Homer, what's your least favorite country? Italy or France?
France.
Nobody ever says Italy.
As far as what the guidelines are, it depends on the state. According to the Immune Deficiency Foundation, the U.S. Food and Drug Administration puts out the federal requirements, then each state can choose to add more requirements on top of this. For example, in Section 630.5 Medical Supervision Number 2, The responsible physician is not required to be present at the collection site if someone has been trained to perform the plasma collection activities. This is mentioned in more than one item of the federal regulation where sufficient training is required, but licensing is not required. State guidelines build off of the federal guidelines, so at a minimum, states are required to follow what is decided at the federal level, but they are within their own rights to add more. As IDEA further points out, California had a hearing regarding plasma donation centers in April 2022 and argued that requiring licensing for employees was a negative impact on the pool of potential donors, mentioning that some states have no plasma donation center. However, when I searched through every state, I was able to find at least one plasma donation center in all 50 states, Washington, D.C., and Puerto Rico. Some states may have more centers than others, but to say that there are states with no donation centers is incorrect. But it's unclear when this information was published on IDF's website or if they are referring to a specific company. States with less donation centers may have other barriers to access, such as geographical or transportation issues, but at this time, there is at least one in each state. As mentioned in the introduction, one of my closest friends worked as a phlebotomist for one of the major 4 companies for 2 years. We'll call her Janet. Keep in mind that every location is different, but at her location, they did enforce the restrictions for those donating plasma, such as turning away donors with anemia, those with unhealed hematomas that prevented a draw, and those who were visibly intoxicated. They also enforced not accepting donations from those who had lived overseas in specific countries and times, donors that had received a blood transfusion, or donors that had a condition that needed certain medical conditions or treatment. These are not unreasonable restrictions for donation, and hopefully every location follows these guidelines. Janet also added that the level of dehydration for donors was somewhat subjective. For example, a donor may come in Saturday morning after an evening out on the town and may be hungover, causing the draw to take longer. This in turn affected turnover times that workers would get reprimanded for. We'll return to work environment a bit later. In the Jacobin article, they explain that Mexican nationals crossing the border into the U.S. weekly to donate plasma for cash was labeled by the U.S. Customs and Border Protection as labor for hire. Now, instead of a visitor visa being enough for these donors, a work visa was required instead, which affected the amount of plasma being donated during a time where the FDA sent out notice of a shortage.
Luis Enrique Garcia Bautista is just one of hundreds of donors who crosses the border twice a week to donate plasma. He says he's been donating for a little over a year, most of the time after he gets off work. His day starts at 7 a.m. and won't get home until 6:30, but he isn't the only one. Javier Zuniga says he's been donating plasma twice a week for 4 years. His wife joined him last year. Each week, he says he gets $25 for the first donation, $40 for the second. An additional income, he says, has been helpful. Javier says he uses the funds to buy groceries, pay electricity, and the internet bill for his children who are doing virtual learning.
In June 2021, the Immune Deficiency Foundation sent a letter to the Department of Homeland Security requesting them to continue to allow Mexican nationals with a B1 or B2 visa to still be allowed to donate plasma as they make up 5 to 10% of donations. A B1 visa is for business-related work, and B2 is for tourism, vacation, visiting friends or family, or medical treatments. The full letter from IDF is linked below, but it's worth noting I'm unable to find the source of where this percentage comes from. In the ProPublica article, quote, calculating the exact number of Mexican donors coming into the U.S. is difficult because companies do not disclose this data to state or federal agencies, unquote. But the fact that IDF, along with private companies, were pushing back against the U.S. government for their ability to collect plasma highlights how much business was affected. Not to mention that this ProPublica article published in 2019 points out how 43 plasma donation centers are close to the border with Mexico, and these companies entice Mexican nationals to cross and donate for cash. There was a shortage in April 2020 as pointed out by the FDA, and this agency adjusted guidelines as a certain contagion was making the rounds that year. For example, instead of requiring 60 days to quarantine plasma before it's released, it was lowered to 45 days to meet growing need. Conversely, with more emphasis being placed on releasing products for medical needs sooner, the window to verify donor eligibility was lengthened from 24 hours to 72 hours. The events of 2020 were not the first time that the FDA needed to reanalyze requirements for medical donation, but it did help push forward revisions for the LGBTQ+ community that had been questionable and not based on any supporting data. Previously, gay and bisexual men had to wait 12 months to donate. Now that time frame is lowered to 3 months. From Chris Walker's article linked below, quote, restrictions on those groups have been in place for decades. In 1985, the FDA mandated an indefinite referral of gay and bisexual men giving blood. citing that the higher prevalence of HIV infections in the gay community during that time, despite the fact that the disease can be transferred regardless of gender or sexual orientation. The policy was changed in 2015, allowing gay and bisexual men to give blood if they abstained from sex for a full year. In 2020, during the height of C-19, that time period was shortened to 3 months, end quote. Young adults that are part of the LGBTQ+ community have a higher probability of experiencing homelessness and living in poverty, and plasma donation can be an enticing solution to help their financial situation. The Human Rights Campaign states that 22% of LGBTQ+ adults live in poverty compared to 16% for straight cisgender adults. The Human Rights Campaign Foundation also conducted research showing that LGBTQ+ still earn less, have higher rates of underemployment, and are more likely to work in jobs with little to no benefits provided. With all that medical jargon out of the way, the main point is that plasma has an important role in medicine and health. Unfortunately, in the US, the pharmaceutical companies have a history of exploiting the economically disadvantaged and marginalized groups. One of the tactics is to build plasma donation centers in areas where people are struggling the most. From the study Blood Money linked below, quote, "We find that when a plasma center opens, the probability that an individual inquires about a payday loan or installment loan decreases significantly by 6.5% and 8.1% after 4 years. Access to a plasma center decreases demand for non-bank credit exclusively among young individuals, who are more likely to donate plasma according to our survey data. Probability of inquiring about a payday loan or installment loan decreases by 13.1% and 15.7% after 4 years for individuals younger than 35. We find that access to a plasma center significantly decreases the extensive margin probability of taking out a payday loan by 18% among young borrowers. These effects are large and are on par with the estimated effect of a $1 minimum wage increase on low-wage workers in Detling and Sioux. A back-of-the-envelope estimate suggests U.S. households save between $180 and $230 million in payday and installment borrowing costs annually because of access to plasma centers," end quote. However, later this study adds, quote, "that there is a bigger impact on increasing savings and decrease of non-bank credit for infrequent payday loan borrowers versus consistent borrowers," end quote. The study focuses on the location of donation centers in comparison to the amount of non-bank credit that is used within an area. While the use of payday loans, credit cards, and similar debts lowers when a plasma donation center is introduced in an area, the question we should be asking is why this is a needed service for people to supplement incomes. Wages have not kept up with the inflated cost of living, so many use plasma donation to fill that gap. To clarify, this video is focused on instances where donation centers gift some form of compensation, such as cash to donors, and not instances where there is a natural disaster and there is a call for volunteer donors.
This is a new drug in the same family of Botox. We don't expect any problems. Your check for $14 is waiting for you at the front desk, and we think you are all going to look beautiful. Okay. Now, if you can begin by just filling out those forms, those are insurance waivers. And then you'll find a list of various aspects of your face. Go ahead and check off anything that you think you might want to improve on just a little bit.
There are multiple sources that point out the strategy of where plasma donation centers are built. From the article U.S. Blood Plasma Industry Targets Poor and Working Class article linked below, quote, "A 2018 study by researchers at Case Western Reserve University found that states with a higher number of plasma donation centers were also more likely to have a higher population of low-income and minimum wage workers. The study also found a higher prevalence of donation centers in states with less cash assistance available to low-income individuals. One researcher, Heather Olson, stated that plasma donation companies are surgically placing donation centers in destitute neighborhoods. Additionally, the study noted that due to inadequate healthcare coverage, quote, "significant numbers of donors would not be able to afford the life-saving therapies created by their own plasma contributions," end quote.
$12 and a free cookie. What a country.
Ja, die 2-3 Geschichten, die sie nur machen, dass sie Geld haben, okay, ja, sie machen nichts Blödes. Aber die da mit den Drogensachen, das ist wirklich, das ist heftig.
Aber es hat mich auch so beeindruckt, wie er liegen, eine Reihe um die andere, wie viele Leute das dort liegen. Das ist Wahnsinn.
Wie viele Leute das für Geld viel machen.
Ja.
Musst du dir mal vorstellen, wie das der Körper schlaucht, 2-mal in der Woche.
Many people are aware that payday loan companies exploit the poor, marginalized groups, military, and other vulnerable populations. These companies are often located in communities with a higher percentage of people in lower socioeconomic levels. With payday loans, they eat up funds, destroy credit ratings, and can ruin lives. Plasma donation centers offer compensation, so in that sense they are marginally better in that they provide funds or benefits in exchange for your time and health rather than a loan. But is the compensation given appropriate or fair? A 2007 article from the National Library of Medicine, Clinical Research with Economically Disadvantaged Populations, one of the concerns is the unfair levels of benefit for participants. Quote, in lacking financial and medical resources, the economically disadvantaged may be vulnerable to exploitation by clinical research studies offering too little benefit for the risks and burdens of study participation. These studies, unlike the studies discussed in Concern 2, are unfair at inception because of their design. They offer too little benefits for the associated burdens. For a hypothetical example, imagine that healthy volunteers in a Phase 1 toxicity study are offered a single $50 payment with no recourse for any injuries caused by the drug, a benefit level that a neutral observer might consider unfair for the time, inconvenience, and risk associated with the trial. Despite this unfairness, an economically disadvantaged woman might make a logical decision to enroll in such a trial. Perhaps the $50 offered by the study presents a needed opportunity to meet her rent, one of her primary concerns, end quote.
In this economy?
This quote mentions Concern 2 in the article, which is that services and goods offered may be attractive enough that a participant will disregard risks associated with the clinical trial or study. This is one of my biggest issues with plasma donation. There are several advertisements from different plasma donation centers offering all sorts of deals, as long as certain parameters are met, and it can be easy to accidentally forget an appointment or have an unforeseen health issue.
Too late now. Come on, I'll catch you.
God save my little broken body.
Missed.
Even if a donor is able to meet all the requirements without issue and receive the full advertised compensation, it can also be argued that this is exploitative. Concern 4 from the article is, quote, even if a study offers a fair level of benefit in exchange for study participation, the fact that economically disadvantaged individuals only enroll because of their limited economic options makes the study exploitative, end quote. The rising cost of housing and food, more and more people struggle to cover basic needs, and participation in a medical trial or plasma donation for monetary compensation is enticing. In the Blood Money study, they explain that 70% of donors are motivated to donate for essential spending, such as groceries, gas, or housing. Conversely, 19% of donors do so for non-essential spending, such as restaurants or concerts. As a short-term solution for households, this is not necessarily a bad option, and can certainly be argued that it's a better alternative than payday loans. However, there should be more efforts to resolve issues with access to housing and other basic needs to begin with, especially since 3/4 of donors participate in order to get cash for essential spending. This isn't even including issues with public or private transportation.
Par l'homme. Le terme qui est utilisé par certains, c'est le nouveau cannibalisme. Et si l'on n'est pas prudent et qu'on accepte une dérive éthique par rapport à ce que c'est que le don, le bénévolat, si l'on accepte de marchander le corps, alors oui, on est capable de tout faire.
From Blood Money, quote, plasma donors cannot earn enough money from selling plasma in 1 week to, for example, cover a typical rent payment. The typical payday and installment loans are $400 and $800 respectively. Saving enough plasma income to cover even small shocks requires weeks of foresight and commitment. We expect that it is harder to commit to donating repeatedly than it is to work for 6 to 8 hours in a single day. This discreteness may amplify the desire for immediate consumption or facilitate mental accounting. Hence, both the direction and the magnitude of the relationship between plasma and non-bank debt is an empirical question, end quote. The study in this article also takes into consideration that while cash is given to donors, the donation centers are not required to report the amounts to the IRS, since it is below their reporting threshold. On the other hand, for donors, it is considered taxable income under self-employment if it is over $400 and should be included in the 1040 SE form when submitting taxes. When speaking with Janet, I asked about the compensation given to donors and how often they received the full compensation as advertised.
Janet.
While she didn't have an exact number, it kind of depended on the situation. She explained that it was company policy that donors had to wait at least a day between donations. There's always the element of human error. If a donor had gone to a hospital or doctor appointment the day before and had blood drawn but didn't mention it, you're not supposed to donate, but this can slip through the cracks if a worker isn't paying attention.
It didn't work out the way he wanted. The center refused him because his blood pressure was too high.
I wasn't able to donate today. My blood, and that's very important because I take my blood pressure medication, and I think I ate that yesterday.
But then, if you can't donate, it's a financial issue for you.
It is.
She added that the majority of donors were doing so for the money rather than altruism. At the time she was working there, roughly around 2010, donors could get $850 the first month for 5 donations. As of December 2023, the amount has not gone up for that company. Some companies will pay $1,000 the first month and others $700, so the amount varies by company. And of course, all amounts are under their reporting threshold to the IRS. There are a lot of terms hidden in the fine print that workers at donation centers don't necessarily go out of their way to explain to donors. It's kind of implied that donors will educate themselves, and when starting there is so much information given that it can be overwhelming, so donors may not ask for clarification. For example, if a donor starts at the beginning of the month, it's easier to meet the number of donations required for full compensation, rather than if they started on the 20th of that month. Another example she provided is that if a donor was unable to finish their second donation, they were given half pay and then had to start over for that month. In the Simpsons episode, Bart receives $12, which today would be roughly $26 to $28, so a half payment would be even lower. Again, we'll get back to the worker aspect, but the amount Bart received for his donation is basically a tank of gas. Hey, he also gets a cookie. And looking at a couple different companies, the compensation schedule for donating plasma varies wildly, depending if there's a tier system, how often they donate, and other factors.
And with over 300 locations across the United States, CSL Plasma is one of the highest paying donation centers in the country. And in July, both locations here in Lexington will be increasing their wages, and new donors will have the opportunity to make up to $825 for just a single month's donations.
Me personally, I have an hour commute back and forth to work every day. So with gas prices rising and everything, it's really helping me out with my gas price.
Assistant manager and longtime donor Benjamin Jones says the recent uptick in donors has also led to people taking a new view on the donation process.
From rent to gas to groceries, the increase in prices is forcing people to find unique side hustles, like going under the needle and pushing out plasma. For Justin Rash, it's been 6 years since he last donated, and he never thought he'd do it again. That was until the recent rise in inflation.
I will be making frequency donuts twice a week. It's a big help, especially with gas and any little help with bills you need. It's a big help.
A quick Google search and you'll find several plasma donation places in Chattanooga.
From the Blood Money article, in 2021, 4 pharmaceutical companies operated 85.8% of plasma centers in the U.S. These are private companies, so it benefits them to try and pay workers as little as possible to increase profits, as well as set a plasma donation to be complex in order to pay out the least amount possible. Plasma is an important part of creating life-saving medications, but if we're going to compensate donors for the toll on their physical body, it should be a higher rate considering the amount of profits these companies gain. In some of the sources linked below, they explain the compensation for donors averages out to about $40 a visit. According to Janet, the target time to draw, collect, and disconnect donors was 1 hour, 15 minutes max if nothing goes wrong and the donor isn't dehydrated. If we count for the time that a donor walks in the door, fills out paperwork, etc., say a donor can spend about 2 hours at a plasma center. If we use that $40 average, that would be about $20 an hour if there are no issues. Janet explained that if there were issues, a visit might be well over 2 hours for a donor. Most of the donation centers offer cash for referrals and other promotions, so that compensation might be $800 to $1,200 a month if all the parameters are met. Not necessarily a bad deal on the surface. Most programs require 2 donations a week, so if there are 8 donations needed in a month, that equals out to about $100 to $150 a month if nothing goes wrong. If we look back at the ads, this is usually compensation for the first month, so that means the compensation for the following months is probably going to be less. But donating plasma comes at a cost, and it can affect your health.
What does the literature say about the long-term effects of donating plasma twice a week?
I couldn't find anything in the literature describing what the effects were. I know from talking to my patients who do donate plasma that they're tired, so they get fatigue, they have headaches. But beyond that, you know, all I know is the Red Cross has 1 time a month, and these guys are doing it twice a week.
In Carlos Delgado's 2019 article linked below, quote, "Blood plasma donation takes a serious toll on the health of the donor, especially for long-term repeated donors. After a blood draw, donors can experience weakness, bruising, dehydration, or fainting. A 2010 study found that frequent paid donors have lower levels of protein in their blood, increasing the risk of infection and liver and kidney disorders. While providing plasma to those in need is a social necessity, the capitalist private profit system has endowed the practice with distinctly parasitic characteristics. Global plasma supply is provided largely by the poorest sections of the working class, driven to sell off parts of their bodies in order to make ends meet," end quote.
Zytrate comes in a little glass vial.
A little glass vial? A little glass vial.
Even though this affects health, these companies push the idea that donating is a net positive and that donors are providing a much-needed service, and these companies act as if they're practically doing a favor to donors by providing compensation. However, in the Jacobin article, quote, "After speaking with more than 100 donors, it's clear to McLaughlin that no one is donating plasma for the warm fuzzies. They need cash. The money, not enough for a full income, at least in the United States," end quote. To return to blood money, quote, "There have long been concerns that compensating plasma donors could exploit vulnerable populations. Few medical studies measure the consequences of regularly donating plasma, and they focus on a narrow set of short-term outcomes. Anecdotal evidence suggests that short-term consequences may include blackouts, fatigue, and susceptibility to infection. Negative health outcomes from donation may carry direct financial costs from diagnosis and treatment. Indirectly, physical weakness may lower hours worked or productivity at a primary job, affecting overtime, bonuses, and commissions. Moreover, health effects, should they exist, may take a long time to build, materializing as a financial cost only after our 4-year study window closes. We cannot rule out the possibility that over time such costs offset the immediate financial benefits we estimate in this paper," end quote. Much like how the compensation for donors may be below market value and the donation center in a quote-unquote shady part of town, it's not a stretch to assume that those working in the donation centers are being paid less as well. According to the Jacobin article linked in the description, when one of the writers interviewed to be a phlebotomist to work undercover, in the interview, the manager was more concerned with customer service rather than her healthcare background. Government policy also affects workers. When there was a decision to restrict Mexican nationals from donating, several workers were laid off. From the ProPublica article, Judge lifts U.S. ban on Mexicans entering country to sell blood, quote, "The pharmaceutical companies are now scrambling to reorganize their centers along the borders after the ban on Mexican donors had prompted layoffs of employees and a reduction in operating hours," end quote. Janet provided details on her work experience as a phlebotomist. She went to undergrad for nursing, so she was certainly overqualified for what the job required and what it entailed. I'm unable to find much information from other sources for reasons that will be clearer later in this section. Janet explained that the job only required a GED and training was all done in-house. There was virtually no say in scheduling unless a worker had school, in which case there was some flexibility. Split shifts were not uncommon and part-time workers were generally assigned to work only in the evenings. Employees were also required to work certain weekends with little to no say, and many hospitals operate schedules in a similar way. Scheduling would be done in an effort to work around providing breaks and lunches as much as possible. If an employee was unable to take a break at a specific time, whether their fault or no, it would throw off the schedule, which could be marked as a demerit. As far as pay, with what her job entailed, it was the equivalent of a lab tech, which would have been paid $19 an hour. Except that's not what she got. In her case, employees started at $11.50 an hour, and as a reminder, this is around 2010. There were virtually no promotions or pay increases. Once a year, there was an annual review, and if they liked you and you fit in with those in charge, you'd get the step pay increase of about 25 cents an hour, once a year.
Whoa! This is worthless.
Demerits were given for things that employees may or may not have had any control over. Janet explained that overtime was heavily discouraged as much as possible. But if they were short-staffed, there wasn't much choice. If you needed a day off, you were required to find a replacement to switch shifts. Employees would be on their feet all day and reprimanded for not actively working every second. No sitting, no leaning. As far as working with the other employees, there was the usual mean girl clique, something that is also not uncommon among nursing staff. Employees were supposed to treat their work similar to as if they were working in a hospital after all. Training in-house sounds nice, especially since the job only required a GED. It was usually done by senior members, and if they felt you were good enough, then you could move on to being on your own. If they were short-staffed and you were trained enough, it was possible you could get thrown into the fire and be tasked with disconnecting donors, while the more trained employees worked on connecting and checking levels. Part of training also involved working with a buddy. Janet had been working as a buddy training new employees, but was relinquished of this task because she was told she could have been nicer with her tone, since she was considered, quote, blunt and straightforward. While she didn't know it at that time, Janet was neurodivergent, and even though she followed protocol, used the sandwich method, was clear and concise, kept a neutral voice, she was reprimanded for her tone. In retrospect, I'd be curious to see if male-presenting employees would have received the same feedback. On the plus side, this job happened to be down the street from where she lived, so she didn't have to use her car if she didn't need to, and they did provide benefits. And in 2010, a steady job with benefits was difficult to find. Overall, Janet explained that the job wasn't terrible, but employees were overworked and underpaid. In general, phlebotomists would have 6 people in a section and they would work in tandem with each other. The job required constant multitasking and checking vein pressures, disconnecting, checking on donors, and other items. If the clientele was doing well and there were no issues, a day could run smoothly. Breaks and lunches were on a schedule, so if one person forgets or there are issues with a donor, it can disrupt that. One manager might say they should have grabbed a float to fill in for their duties, while the other might say they should have finished before taking their break. Even the clientele noticed when employees were giving conflicting information or put in a no-win situation. Janet couldn't outright agree with their opinion, but she could acknowledge that she heard them. The majority of donors were between the ages of 30 and 40, which matches with much of the information gathered for this video. At times, there would be college students too intoxicated to donate that weren't stopped at check-in, so they had to be turned away. Why might they be coming in if they're clearly hungover or drunk? Well, part of the deal with receiving compensation is donating twice a week, so Saturday might be the last day in the week they are able to do so for cash, and they try to slip in under the radar. Then there are the donors that come in dehydrated after drinking 6 cups of coffee that morning, so not only does the collection process take longer, but if they need the restroom, it's going to feel like an eternity before they can. Of course, there are the fun clientele. Janet spoke about 2 ladies that would come in and race to see who had the shorter collection time. As mentioned before, if there are issues, a draw can take over 2 hours, and since phlebotomists were tasked with keeping them to 1 hour 15 minutes max, this was a problem at times. One person might have 6 donors that need connects all at the same time, so for 3 to 4 hours they are constantly trying to complete all the tasks necessary for all 6 clients they are handling. They could grab a float if one was available, but there was definitely some side-eye from them in return. For the most part, Janet explained that there weren't many complaints from donors about the staff. Complaints were usually medical-related or annoyance that required steps in the process. For example, if a donor had 2 blood losses in a month, they have to wait 6 weeks before they can donate again for compensation. If they didn't properly take care of a hematoma or they were not healed enough, they might get turned away at the discretion of the staff. If there was a bad stick, they would simply get a more senior member of staff for the second try, so this usually wasn't an issue. Donors are also required to do a blood draw for testing at certain intervals and might be annoyed if they have to go in just for that task. Last example is that if a donor decided to eat right beforehand and their lipids were high, it would cause the plasma to be cloudy, disqualifying them from being able to donate. Luckily at her location, corporate oversight didn't feel like a burden and the precautions and tasks required were reasonable. Even though direct supervisors were a pill, the upper management seemed to actually listen and care about feedback. Some staff mentioned they felt that the company was too strict on cleaning, but in my opinion, any location dealing with medical equipment and fluids should follow every precaution necessary because germs can easily move around.
With a simple sneeze. And then a handshake. Perhaps an accidental collision. Then a simple touch on the shoulder. And just like that, you have a patient in trouble.
There was high turnover at our location, and much of the staff was college-aged. If there were staff issues, employees were requested to resign rather than be fired. For those who had this as their first job, they may be unaware that this allows a company to work around paying unemployment. If an employee is fired or let go, they can get that benefit. If they willingly resign, it is significantly harder. Janet couldn't confirm if the staff would make work hell to push an employee to quit, considering the job itself was hell to begin with. So that Simpsons episode might be a slight stretch in that the person working accepting the ID from Bart to be able to donate, but it's not out of the realm of possibility, especially if they are overworked and underpaid. The Jacobin article, quote, "If my insurance is paying $12,000 per dosage for this medicine, how much are the people supplying plasma getting?" In Delgado's article, he points out that pharma companies are able to sell it for $300 wholesale while paying donors roughly $30 to $50. From the article, quote, "There's a whole profit scheme," as he continued. "They give us so little, but they get so much. It's like a typical medical industry stunt." It's the same thing with big pharma. They want you to get addicted to opioids, so they sell more of them. They want your plasma because it's expensive. But they don't want to pay you, so they go to the poorest places and pay the least amount they can, end quote. At first glance, the $12,000 may seem high in proportion to the $300 wholesale. However, it's worth considering that biologic medicine and immunotherapies may require donations from 10 to 100 people in order to get the amount of immunoglobulins necessary. Currently, these are human-based and not able to be replicated in a lab, so that $12,000 is partly derived from how many donors are required. The base plasma, the biggest portion of plasma donations, is the most easily accessible and sold to hospitals for trauma patients, as it is easier for the body to accept plasma versus saline.
Im Gegensatz zu den anderen Blutbestandteilen ist es beim Plasma so, dass nur etwa 20% dieser Menge direkt in den Spitälern gebraucht werden. In den Spitälern gebraucht heißt für Patienten, die einen großen Blutverlust haben und dieses Volumen ersetzt halten müssen. Der restliche Anteil, das sind fast 80%, geht in die sogenannte Fraktionierindustrie. Das sind Firmen, die daraus stabile Blutprodukte und Medikamente.
That said, according to Blood Money, between 2009 and 2021, the number of plasma centers tripled in the US, from about 300 locations to 1,000. It's also worth noting that the majority of plasma donation centers, 85.5%, are operated by 4 global pharmaceutical companies. Yet despite this, quote, at least 70% of demand from hemophiliac and primary immune deficient patients is unmet. Hundreds of thousands of newborns die or have brain damage because a plasma-derived medication is unavailable. And doctors in some countries do not attempt to diagnose these conditions because treatment would not be available. As global demand continues to grow, the reliance on compensated plasma from the United States will likely continue to drive rapid expansion of U.S. plasma centers and search for new donors, end quote. While there is demand for these treatments from plasma, annual market growth of 11% for the U.S. plasma section should not be ignored. The study further clarifies that 22% of the U.S. lives within 5 kilometers of a plasma donation center. Donors tend to be young, low income, have low financial assets, and little access to bank credit. The study concludes with, quote, without measures of the costs of potentially adverse outcomes, we cannot comment on whether the ability to donate plasma improves household welfare, end quote. As mentioned earlier, the compensation for plasma donation has mostly stayed at the same amount for the past decade, yet pharma companies are showing a growth in profits. I'll end with this quote from one of the participants in Delgado's article, quote, I've done plasma donation in a lot of different cities and states, she said. Every place is different, but they still pay very low. The economy doesn't help any, and gas is high, so you have to get it from somewhere. We get gas money from here. If we need Pampers, milk for the baby, toiletries, that's what we'll come in here for. I think more people might come if they were giving more money. A lot of times I do feel sick and queasy afterwards. I eat and drink plenty of water, but it's the simple fact that they're taking your immune system. It's draining, end quote.
Vous avez déjà vu un centre de collecte de dons aux États-Unis, de CSL par exemple, ou de Octa Pharma? Vous savez comment ça se passe là-bas? Next question, please.
Does it make sense for the legislator to ask so few questions? The industry hides behind the trade secret, keeping the authorities in the dark.
Janet explained that when donating plasma, your blood level depletes and it's dehydrating. Considering the current state of healthcare within the U.S., we need to consider both the short-term and long-term effects. After all, waning health means a less productive workforce. Stagnant wages and increased cost of living create an environment that makes it easier to exploit marginalized groups, and I don't think it's a coincidence that many of the plasma donation centers are placed in low-income areas. Plasma is an important medical resource, and we need to compensate donors appropriately and improve the healthcare system so that they can properly recover and maintain good health. Money for plasma may be an improvement from payday loans, but it comes at a cost, and it's still not addressing the root cause of why so many people are struggling financially.
L'abomination. Non, c'est dégueulasse.
Until next time.
Remember, treat other people the way you want to be treated, okay? I've got to go now. So long!